You good?
Hello.
Hello. Yes.
Hey everybody, you are now tuned into the Blackout on Afro Vibes Radio, the number one online internet radio station with your girl Tequila. Today we have a very special guest. And when I say special, I mean as in it is my mother, Miss Angela Banks Pete. It's great that she was able to come in today. As I let you guys know, for the last 2 weeks, every week I cover something that has to do with awareness for the month of October. So for this week, we're going to highlight breast cancer. And the reason this show is special to me because my mom is actually a breast cancer survivor and she's been one for 17 years. Hi, Mom.
Hello.
Thanks for coming on again. I don't know if you guys remember, but she came on a couple of months back. She's actually a financial advisor and she does insurance as well. But today she's going to try to educate, well, she is going to educate us on breast cancer. So why don't you go ahead and introduce yourself and tell us a little bit about your story.
Okay, my name is Angela Banks Pete. Um, a few years ago, I found out that I had breast cancer. And in regards to that, I had just relocated. I just relocated to Houston from Georgia. So I dealt with a lot of stress in my life in regards to relationship, as well as professional. And so I just came home to visit, and some other things transpired. I ended up relocating back home. And about a month or two after I relocated back home, I was in a deep sleep, and something told me to touch my left breast when I wake up. So that's the very first thing that I did. I touched my left breast. And so, lo and behold, I had a lump. And I ended up going to like 6 or 7 different doctors because I didn't have any insurance at that time because I just left my job when I relocated from Georgia to Texas. So I went to 6 or 7 different doctors, and I was just like in my early 30s at the time. So nobody wanted to, test me for breast cancer because I was under 40. And so, with that being said, I had to go to so many different doctors, and finally, I went to LBJ, and LBJ diagnosed me as stage 3 cancer. It was the size of a golf ball, so it was half a centimeter from spreading. So it's like you have to trust yourself, and you know your body more than anyone. So if a doctor tell you no, it's not this, it's that, you have to go with your gut feeling. Your gut feeling can save your life. So luckily, I went to several doctors before someone would finally listen to me, being that I was in my early 30s, and they called it just in time. Me, at the time, I was a single parent raising, a young lady, and I was not gonna allow cancer to win. I refused to allow cancer to win. So I made up in my mind that I was gonna beat this. This was only going to um, be a challenge that I have to overcome. I had to go through it to get to where God wanted me to be. So I made up my mind, and what I did during that time frame while I was going through chemotherapy, I traveled more than I'd ever traveled in my life. I also laughed. I was always reading something funny, watching funny movies, just keeping my spirits up because that's key. How you look at your situation, you don't allow your circumstances to define you, and I didn't do that.
Mhm. And I remember when we found out she had cancer. I was in middle school, so I was really young, like 11. Yeah, I think like 11 or 12. And I remember you were like, I'm not gonna just sit here and let my hair fall off. You actually went and cut your hair off yourself. But a lot of people didn't even know that you had cancer. People thought that you purposely just, was trying to do like this Erica Badu thing and just shave your hair off because you always kept your makeup done. You kept dressing, nice like you always did. You carry yourself like you wasn't sick. And sometimes, that threw some people off because they was like, oh, she ain't really sick. She ain't really got cancer. But I think it's because you had in your mind, I'm not going to allow this to defeat me. So you kept presenting yourself and living like nothing was really going on the inside, even though I know you had a lot of struggles. And I know you tell me all the time, you was like, I have a daughter, so I have to keep surviving. I have to show her what it's like to defeat certain things. And so I always appreciate that about you. Along with your story, I want to make sure that we educate the audience. This is just a couple of breast cancer facts that I got from the National Cancer Institute. Breast cancer is made up of glands called lobules that can make milk and thin tubes called ducts that carry the milk from the lobules to the nipple. Breast tissue also contains fat and connective tissue, lymph nodes, and blood vessels. The most common type of breast cancer is ductal carcinoma, which begins in the cells of the ducts, and breast cancer can also begin in the cell of the lobules and other tissues in the breast. Ductal carcinoma in situ is a condition in which abnormal cells are found in the lining of the ducts, but they haven't spread outside the duct. Breast cancer that has spread from where it began in the ducts or lobules to surrounding tissues is called invasive breast cancer. In inflammatory breast cancer, the breast looks red and swollen and feels warm because the cancer cells block the lymph vessels in the skin. Now in the U.S., breast cancer is the second most common cancer in women after skin cancer, and it can occur in both men and women, but it is rare for men. And each year, there are about 100 times more new cases of breast cancer in women than in men. From 2008 to 2012, breast cancer incidence rates increased by 0.4% per year in Black women and 1.5% in Asian and Pacific Islanders, while they remain stable amongst whites, Hispanics, and American Indians and Alaska Natives. Even though Black women have historically had lower incidence rates than white women, death rates among Black women have historically been higher, and that has continued. In fact, the Black-white disparity in breast cancer death rates has increased over time. By 2012, death rates were 42% higher in Black women than white women, and breast cancer incidence rates are also higher among Blacks than whites for women under the age of 45, and the median range of diagnosis is 58 for Black women compared to 62 for white women. And that last fact is important because I know you said a lot of times they don't even want to test you for breast cancer if you're under the age of 40. How old were you again?
I was in my early 30s.
So like 31, 32 when you found out you had breast cancer, which is why it was such a hard struggle for you to actually get tested. During that time, can you kind of tell us about some of the battles you went through as far as, going through the process of chemotherapy and having to get your breast reconstructed? Like, what was it like going through that breast cancer treatment?
Okay, going through the treatment, it was challenging because you have your good days and your bad days. Because remember, they're putting poison in your body to kill off this cancer. And you have to drink a lot of liquids, a lot of fluids to flush that through your body. And so otherwise, you will be sick a little longer as opposed to just a couple of days. So it was a struggle going through the chemotherapy. And I want to go back to where you were saying how I presented myself. So because I made in my mind that I was going to survive cancer, I would keep myself up. When I would go to chemotherapy, my mother would take me, and she worked like 12 hours. And when she would get off work, she would take me to chemotherapy. So when we would go, she would just be exhausted. So people would think that my mother was going to get chemotherapy as opposed to me, because I was dressed up like I was a business professional. My business clothes, my hair, my wig on, my makeup. And then when I would go into chemotherapy, they're like, oh, you're the one coming for chemotherapy, not her. And so they would all be in there just looking sad and pitiful, like they've just given up on life. And I would go in there and I would have them laughing and joking. And, I'm reading my books on real estate or whatever at the time, just thinking about what my future is going to be like, because I knew I was going to overcome this. So back to what you said on what I went through. Now, the chemotherapy aspect, like I stated, that was a little challenging, having to put that, I had to take 6 cycles of chemotherapy, and it was like 4 different medications that they would inject in me. And so after doing the chemotherapy, I had a mastectomy, and I think that was more challenging for me than the chemotherapy, because I felt like I was less than a woman because I only had one breast. Yes, they took my right stomach muscle and rebuilt my left breast. So for, you know, externally, yes, I look like I'm okay, but internally, it's been years later, I'm getting emotional, and I still feel like somewhat less than a woman because I had a mastectomy. I'm here, I'm still here, and that's a blessing, but still.
Yeah, I understand because that's still, we're women. We have certain features about ourselves that make us feel like women. And when you have something that alters that, it can make you feel, another type of way. But I mean, you're still beautiful, Mom. I mean, I told you, if I was just a regular person on the street that didn't even know anything about you, I would have never known your story that you had reconstructive surgery in your breast. So I think that's a blessing that even that you were able to reconstruct it, because a lot of women, I know they actually get the full, mastectomy, and they don't have either one of their breasts. And then you've made it for 17 years where you've never had to worry about relapsing into getting breast cancer again, which is like so unheard of these days. Some people, they keep falling back into it and back into it, and you didn't have that. And one of the reasons is people don't know, but my mom's been a vegan like practically my whole life. So what are some of the lifestyle changes or whatever you did to maintain to help from having to fall back into relapsing?
That's key, is watching what you eat, what you put in your body, because if you are overweight or you're obese, you're increasing your chances of having breast cancer. So once I became a survivor, I really wasn't a meat eater, and after I became a survivor, I just took meat, poultry, and seafood out of my diet. And I'm just more conscious in regards to the fruits and vegetables, that I put in my body, so I can sustain and be here for a longer period of time and be here for my grandkids, for my daughter, and so you have to change yourself mentally and physically. You have to exercise 30 minutes a day. You have to be conscious in regards to what you're putting in your body.
And just so our listeners can kind of understand, you said you had stage 3, which is basically a tumor that's larger than 5 centimeters, and cancer spreads from 1 to 3 auxiliary lymph nodes, or the lymph nodes near the breastbone, which is found during a sentinel lymph node biopsy. Your standard treatment was chemotherapy, which is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. It will shrink the tumor and reduce the amount of tissue that needs to be removed during surgery. Now, I know you said the way that you found out is you were in a restroom and that you touched your breast and you said you found a lump. Well, these are just some signs of breast cancer for the ladies out there, even the men, in case you're wondering how to check yourself. So these are what you can look out for: a lump or thickening in or near the breast or in the underarm area, a change in the size or the shape of the breast, a dimple or puckering in the skin of the breast, a nipple turn inward into the breast, fluid other than breast milk from the nipple, especially if it's bloody, scaly red or swollen skin on the breast, nipple, or areola, the dark area of the skin around the nipple, or dimples in the breast that look like the skin of an orange called peau d'orange. Now, I know you said you had a lump. What did the lump actually feel like when you touched it?
Because I know my body, it didn't even feel like the size. It was the size of a golf ball, but it didn't feel like that. It was just like something abnormal was there. I felt a lump, and I just kept going around it. It wasn't sore or anything, but it wasn't normal.
Okay, because I know sometimes, like, even at my age, like, I'll go check my breasts when I'm in the shower after I have my menstrual cycle. But we also have, ducts, which is like what your milk comes out of. And sometimes I know a lot of girls my age or women my age, we mistake that for possibly being a lump, but that's not what it is. So I just want people to be able to understand the difference between the two.
It was like something that was hard under my skin. Yeah. So it wasn't able to move around,
Okay. Okay, wow, that's crazy. And what type of breast exam did you continue to get afterwards in order to kind of monitor to make sure you weren't getting any
you get
signs?
a mammogram, for the first 6 months, and then, every year after that, just to make sure, it doesn't reoccur.
And basically, a mammogram is just an X-ray of your breast, and they go inside and kind of look to see what tissue is kind of abnormal inside of you. And since then, I mean, have you had any of the issues, that may have concerned you about getting breast cancer again?
No.
No? Okay. Anything else that you want to share with everybody as far as like, how you're continuing your survival and any advice for women who may be single mothers out there that's feeling alone and feel like they can't find the resources? Because I know at one point in time you did reach out to places like Susan Coleman, and they didn't actually want to help you because you were a woman of color. What were you able to do?
Yes, so I did reach out to several organizations because I needed financial help because I had just relocated from Georgia. So I no longer have my job. I relocated to Houston. So the benefits I had paid for all those years, I could no longer use that. So luckily, I was able to use my 401k. So I was waiting on temporary disability to kick in. I was able to utilize my 401k to sustain me until the temporary disability kicked in. You definitely have to have a support system, someone that you could be vulnerable with, someone you could share what you're feeling. Because at the time when you're going through, you're thinking about you. You're not thinking about your supporter or your kids, how they are feeling through that process. So I didn't know years later, how you felt. About me having breast cancer. I just knew about what I was going through. And even my mother, I only seen my mother cry once in her life. That was when her mother passed away. And so when they told me that I had breast cancer, I was just like, okay, just cut it out, And that was the second time I ever seen my mother cry. And I realized then this is affecting her because I'm being her only child. How, is my mother going to deal with this process? So she was there for me for every chemotherapy appointment I had, every doctor's appointment. My mother was my biggest supporter. And for the single mothers who are dealing with this, you have to sit down and share this with your child. Let them explain it to them that this is just a process that you're going through because you don't know what their child is feeling. You don't know what other people are telling that child. So they probably think they're losing their soul, support, their mother. So you have to sit down and explain that process to them.
Okay, well, we're going to continue our conversation. We got to take a quick commercial break, but when we will return, we'll continue our show on breast cancer awareness. You're listening to the Blackout on Afro Vibes Radio with your girl, Taquila. Hold on, can I redo the commercial break thing? I got tongue twisted. Please, back that up. And it's okay if the show run over like to 35 minutes or so. Okay, let me just say the whole thing. Yes. I'm probably gonna say okay again, but okay. Yes. All right, we have to take a quick commercial break, but all right, well, we have to take a quick commercial break, but when we return, we will finish our conversation on breast cancer awareness with my mom, Angela Banks Pete, and we're also going to have a special caller by the name of Irish Parker who is currently battling breast cancer. Until then, you're listening to The Blackout on Afro Vibes Radio with your girl, Taquila. Whatever. Okay, I'm gonna call and get her on the line. Okay. We gotta find her number. Well, I guess I
I'm
can call
calling
you.
you shit. Give it like 5 minutes.
How far I go over like a minute?